Hi,
Um,
Saran. I'm
Hi,
already
doctor.
here. How is
Alright,
this?
doctor. Um, Hi, doctor. Do you want to try screen sharing?
Share and see.
Alright, doctor.
Can you see?
No, doctor. It's not on the screen.
Doctor, have you opened your slides already?
Yes, I've opened my slides.
Okay, try pressing share again on StreamYard, Doctor.
I can't. Hang on, no? Okay, great. Now
Yes, it's in, Doctor.
it's in. You can see.
Yes, so you can open
Yes.
your PowerPoint, Doctor, and we will later just present the PowerPoint. Yes, perfect, Doctor.
Okay, perfect.
Later when you are presenting, just press the present button
Right.
on
Okay.
PowerPoint.
Okay. So now you're okay.
Yes, Doctor. Great.
Okay. Can you see the change in slide?
Yes, Doctor, can.
Can.
But then later it would be better if we make it full screen, Doctor, the PowerPoint.
Sure. Okay.
Yes, that's the
Like
one.
this. Okay. Okay.
Yes. Okay, Doctor. Perfect.
Okay.
Thank you,
Thank you.
doctor.
So, Doctor, we
So,
will wait till 12:30 and we will start on
So I
12:30.
don't have to go into the YouTube one.
Not necessary, Doctor. Unless you want to have a look, then fine. But I would not recommend, Doctor, because you can
Okay.
see
Sure.
almost everything here.
Okay. Sure. Fine.
Okay, Doctor. Thanks.
Okay. Okay. So when you let me know when you want me to come in.
Okay, Doctor. Sure.
Okay. Right. Bye.
Welcome. I'm Nurdania Shohaila, and I will be your host for this session. I am very pleased to be here with you today in this workshop, which is designed to know more about prenatal and postnatal care. This workshop is the result of a collaboration with Obstetrical and Gynecology Society of Malaysia, which is known as OGSM. At this point, let us get to know more about our featured speaker, Dr. Murali Ganesalingam. For your information, Dr. Murali was involved in formulating and reviewing national guidelines on management of anemia in pregnancy and methods for determination of pregnancy. Apart from that, he has also organized numerous courses and seminars, including the first national seminar on clinical litigation and risk management in obstetrics and gynecology in Malaysia. Dr. Murali was the senior consultant and head of department at the Department of Obstetrics and Gynecology at Hospital Ampang, and currently hold the same position at International Medical University IMU. He is also the president of OGSM, which is based in Kuala Lumpur. Now, without further ado, we will turn the time over to our speaker. Again, he will be presenting about prenatal and postnatal care. Let us all welcome Dr. Murali Ganesalingam.
Hi, good afternoon. First and foremost, I'd like to thank the organizers of AMSA for having invited OGSM and me here to give this talk. It's very encouraging to find young people who are involved in antenatal care and in the dissemination of information with regards to mothers. Now, the talk that you had asked me to give was on safe motherhood. And safe motherhood is actually something that is very, very important, not only for us in Malaysia, but also for those in the worldwide, in the entire world. We find that a lot of people die during or have morbidity during the delivery process. And this Safe Motherhood initiative actually was a global thing. It started long time ago. So it makes me very happy to find that young people like those with AMSA are involved with this and who are going about promoting the dissemination of information on prenatal care and postnatal care. So now I'd like to share some slides with you and start my talk. Can you all see my slides?
Yes, sir.
Okay. Now, Safe Motherhood is actually a series of initiatives. This started a long time ago, okay? And it started as a global thing. The reason it started was because we found that there are lots of mothers who were dying during the provision of, during the delivery process. And we found that there were many things that were missing. And we found that there were so many avenues for us to make changes to ensure that mothers receive high quality medical treatment during their prenatal, delivery, and postnatal care. And this includes things like family planning, optimizing patients before their pregnancy, and taking care of the mother, the fetus, and the infant during the pregnancy. Now, it's a global effort, like I told you before, and it started a long time ago. In fact, the Safe Motherhood initiative started in 1987, but the move to try to reduce the amount of the number of mothers who have some amount of problems during their pregnancy and delivery started much earlier. So when this Safe Motherhood initiative, the global effort actually started in 87, and the aim at that time was to reduce maternal deaths by at least half. We understand that pregnancy and childbirth are special events in a lady's life, and we also understand that a lot of them are apprehensive about getting pregnant because they don't know what will happen. They don't know if they will have issues with their pregnancy or their childbirth, which may result in some sort of morbidity for them. But you must remember that pregnancy itself is a physiological process. It is something that is natural. It will occur irrespective of whether there's a doctor there or not. But the doctors are there and the healthcare professionals are there simply to try to identify the risks to the health and to the survival of the patient, of the mother, and of the infant that she's carrying. So when we look at all of this, the initiative actually looked at many things. They looked at things like family planning. They looked at things like antenatal care, obstetric care, the postnatal care. And sometimes if the pregnancy does not carry on and you miscarry, then the post-miscarriage care. We also looked in certain areas, even in Malaysia, for example, looking at the control of sexually transmitted diseases, HIV, AIDS. So if you look at your antenatal, when you go in for your antenatal booking, you will find that one of the blood tests that we do is to look at infections such as sexually transmitted infections, HIV and AIDS. So the safe motherhood as a human right actually started way back in 1928. And then we started having, we were wondering, because there were about 500,000 mothers who were dying worldwide. And we wanted to find out why they were dying. And we started, in the UK, for example, they started a confidential inquiry into maternal deaths. Now in Malaysia, we follow that as well. We have a confidential inquiry to look at all mothers who, for some reason, had passed on during their pregnancy. And we try to identify the reasons why this happened and try to remedy these reasons. In 1998, the WHO got into the picture and they determined that the World Health Day would be, in 1998, will be devoted to safe motherhood. And the idea was pregnancy is special. Let's make it safe. This also came into the Millennium Development Goals and under maternal health. And it is now one of the things that we follow as under the MDGs, that Millennium Development Goals that we have today. So when we looked at all of this worldwide, we saw that maternal sepsis was one of the leading causes of maternal mothers dying or having some sort of disability. The second was bleeding during the pregnancy. Now, more and more we find the third is blood clots during pregnancy and high blood pressure during pregnancy. Now, these are the last two are things that are coming in right now. They were not there when we first started these initiatives, and they've now come in and they are playing a bigger and bigger role in the number of mothers we see who undergo some sort of a problem during their pregnancies. So these are the things that we try to identify and try to remedy before embarking on a pregnancy. Now, this slide here will show you actually the maternal mortality rate in Malaysia. So if you look carefully, in 1900s, it was 1950, it was more than 500 per 100,000 deliveries. But in 2011, it has come down. It is now around 28 per 100,000 deliveries. So we have put into our practice certain features which will allow us to remedy the situation and which will allow us to try to identify mothers who are at risk and try to optimize their care so that they do not suffer any problems during their pregnancy. In this, you will see all the things that we started implementing. Like in 1957, for example, we started having a rural health plan. So there were midwives who were trained to try to try to help mothers' delivery. Then subsequently, we started having audits in 1975 to find out why are these people, why are mothers having problems during pregnancy, and all this, and then hospital deliveries. So all of these actions that were taken by the Ministry of Health all helped in reducing the maternal mortality rate, in Malaysia as a whole. And worldwide, we found that there are three things that are really important. three reasons why mothers have some problem when during their delivery. The first is they delay seeking appropriate medical help. So when there is a problem and there is an obstetric emergency, like for example bleeding, there is a delay in going to a doctor or to a healthcare facility to get help. The second problem was there was a delay in reaching the facility. Sometimes mothers were staying, at that time especially, they were staying in rural places where there was no access, there was no easy access to obstetric facility. Therefore, they took time reaching there. And the third, of course, was because we had inadequate staffing in the hospital facility and inadequate facilities at the hospital. There was a delay in receiving adequate care when they reached the facility. So all of this put together, now I would like to try to identify the reason. All that I mentioned earlier was more as a prelude. It is a prelude to let you know that these things have been there for some time and why we started doing it. Now, AMCCS talk today, they would like to talk about, they had asked me to talk about the pregnancy and how to have a safe pregnancy. So to start this, the most important thing is, when is the best time to plan what is best for your pregnancy? So you have to plan for your pregnancy. So when is the best time for you to plan for your pregnancy? Actually, the best time to plan for your pregnancy is before you get pregnant. So there are lots of mothers who have got diseases. They may already have some disease like diabetes or hypertension for which they're taking medication. So all these diseases will have repercussions when you get pregnant. Therefore, the best time to plan for a pregnancy is before you get pregnant. And the reason is because, number one, you need to try to control this disease. If you're a diabetic, for example, try to control your blood sugar. If, for example, you're taking certain medications for certain illnesses, like say if you're an epileptic, you need to try to control the medication, find out if you're taking optimum medication, find out if the medication is going to have a problem with your pregnancy, and to change the medication if necessary. The second thing is, if you are a mother who already has children, then we look at your risk. How did you do in your previous pregnancies? How do you have any family risk of having a baby who might not be, or who might have some risks if you get pregnant? And to see whether we can identify these risks and try to remedy it. The third thing, of course, is to optimize your health. This is important. You see, the environment that we live in today, you find that there are lots of people who promote lots of supplements and health products. Now, there's nothing wrong with supplements or health products. But if you were to ask me, the best thing for you would be to have good meals at home. You can eat anything you want, but eat more fruits, more vegetables. Drink a lot of water. Walk every day. That early morning walk or evening walk, when you have, say, even for half an hour, it serves a big purpose in your life, because one, it allows the blood in your body to move. Secondly, it causes all the good hormones, what we call endorphins, to come out. Therefore, all of these hormones they are what you would call feel-good hormones. All these feel-good hormones will be there in your body, and you feel better. Therefore, when you feel better and you are in a better mood and you are in a better mental state, it reflects on how your pregnancy is going to carry on. It helps you enjoy your pregnancy. Now, supplementation. One of the most important supplements is folic acid. So we actually advocate taking folic acid 3 to 4 months prior to, even up to 6 months before your pregnancy. And in many countries, even in Malaysia, in certain products, folic acid is added on to the milk. and we will ask you to change your lifestyle or modify your lifestyle so that it will be beneficial to the progress of your pregnancy. So assuming you have a job that is terribly stressful, that stress is going to have an impact on your pregnancy. So perhaps you want to try to modify that stress, inform your co-workers that you're planning to get pregnant so that they can give you, they can make your work life a little bit more palatable for you. If you are the kind of person who does not get too much of exercise, try to exercise. If you have stress in other areas or aspects of your life, then you can try to reduce that stress. Like if getting somebody to help you at home, if you have children at home, getting somebody to help you with the housework, and of course your partners or husbands, they should help you progress with the pregnancy, because although the pregnancy is something that the mother carries, you must remember that the father plays an important role as well, and he should get involved with the progress of the pregnancy and to make sure that the pregnancy carries on without any hiccups. So all of this, if you try to identify early in pregnancy, that means right at the beginning itself, and if you optimize all of this, then it will result in you having a better pregnancy. Lots of people talk about clothes to wear. They talk about milk to drink, tablets to take. But really, the most important thing is having a healthy diet with lots of fruits and vegetables and water, and walk every day. Lots of people will turn around and tell you drinking so much of water will make me go to the toilet more often. But it is better for you to go to the toilet more often and remove all the toxins that are in your body, which the water will do, than for you to carry on by reducing the amount of fluid in your body. Now, the next thing that you would want to think about is, what do you do during the pregnancy? Now, once you've optimized yourself, that means that you know that you're getting pregnant, you have seen a doctor, you have spoken to the doctor has identified your risks, and the doctor has said that, look, everything is fine, you can now proceed to get pregnant, and has advised you on what to do, then you can get pregnant. The important thing during your pregnancy is to book early. So if you were to ask me when to book, my advice to you would be, as soon as you've missed your first your menses, you should maybe do a home pregnancy test, find out whether you're pregnant, and the minute you know you're pregnant, it is good to see a healthcare provider. Now, within the government service, within the Ministry of Health, we have the Klinik Kesihatan Ibu dan Anak. So you can go there and book. Sometimes they will tell you to come at about 12 weeks, but most of the time, if you go there, you will they will book. They will take down your details and give you and book your pregnancy. It's important to book your pregnancy with the healthcare provider who's closest to you, because that way, if something were to happen, then they will know that you're pregnant. The idea is to know who is pregnant in a particular area, so that if something were to happen, the ministry in government service is able to in public health is able to send someone there to look after your pregnancy. Now, the other thing that during my years as a doctor that in the public hospitals is, sometimes history that we obtain is not complete. We don't really know. Sometimes mothers forget to tell us that they are taking certain medication. Sometimes they forget to tell us that they've had certain illnesses earlier in their pregnancy. Sometimes they forget to tell us that they've got other issues, personal and otherwise, that may have an impact on the pregnancy. So it is when you go for your booking, it's very important that you tell the doctor or the healthcare provider who's there everything that might be relevant to your history, and sometimes even those things that are not relevant, and let them decide. and you must attend diligently. You see, as a rule, what we do, what is followed in most antenatal healthcare provision areas is to try to see a mother, a pregnant mother, every 4 weeks during the first, say, 20 weeks of pregnancy. A pregnancy is about 40 weeks. So during the first 20 weeks, we try to see you every 4 weeks once. So when you first go there, what the doctor would like, or the healthcare provider would like to do, is find out, are you actually pregnant? And if you are pregnant, where are you pregnant? Are you pregnant within the womb, or are you pregnant outside of the womb? Which is a very important fact in the management of your pregnancy. So once we have done that, then we will look to see what your risks are. If, for example, you are diabetic, then your follow-up will be very different from that of a person who does not have that disease. If, for example, you have babies who were small previously, your follow-up will be very different. If you have had, say, diseases like high blood pressure during your pregnancy, your follow-up again would be different. Therefore, when the healthcare provider tells you that you have to come back, say, even every week or every 2 weeks, because they want to monitor certain aspects or certain indices in your body, then it is important for you to attend diligently. They will also give you advice on what to do. You must follow this advice. It is important. Among the advice would be things like trying to control your stress. You see, stress, as a rule, you must remember, if you have stress, this stress will have an impact on your pregnancy. So it has an impact on your baby. So you should try to control your stress during your pregnancy, and you should try to control it from before you get pregnant. So once you control your pregnancy, once you control your stress, then it is important, because that way, one, you are in a better situation to enjoy this pregnancy, and secondly, the baby doesn't have is not exposed to hormones that may be detrimental to her, to the baby. Okay, like I told you about fluids, you must drink a lot of fluids and exercise. Now, by exercise, I don't mean doing strenuous exercise, but your body has got blood, and this blood needs to move. Sitting at a computer the whole day is really not very good. Similarly, if your job involves sitting at the office desk, it's also not very good. So my advice is, every half an hour, get up and move a little bit. Okay, if you have time, either in the morning or in the evening, walk. You don't have to do strenuous exercise. Just walk, and you can walk at your own pace. But just allow the blood in your body to move. You know, if you're taking medication, you must inform your doctor that you're taking medication, because various medicines have an impact on your baby. You know, and therefore, if you're taking medicine, however, whether it is medicine that you buy at a pharmacy, or whether you buy this medicine at homeopathic provider, you must inform what you're taking. Most hospitals have got antenatal classes. Now, these classes are important, because these classes, like for example, in most public hospitals, we will ask you to attend the antenatal class, because there are a couple of things that we will inform you during this class. First and foremost, we will tell you what will happen to you during your pregnancy. Okay, that is important, because especially for first mothers, you don't know what to expect during your pregnancy. In these antenatal classes, they are geared towards letting you know, look, this is what's going to happen with your pregnancy. As your pregnancy progresses, you will start feeling certain things. You will start feeling your baby move. You will have to know how your baby moves. You will have to know what happens to your baby towards the tail end, and you'll start having certain pains. A lot of people complain of back pain. A lot of people complain about going to the toilet, going to the bathroom very often to pass urine. All of these are natural things that occur to you during your pregnancy. And You will not know that it is normal unless you go and someone tells you it is normal. Now, aside from this, these antenatal classes also will tell you what could happen during the pregnancy. Sometimes when you get pregnant and you are about to deliver, certain things can occur, meaning that suddenly we may find that the baby is not is having some sort of issues, maybe some distress. This may necessitate us, the doctor, to do a instrumental delivery or to do a operation to remove the baby. All of these things, it is not possible for the doctor to explain everything in detail during the time that you're having this problem, because there is no time. If we delay, the baby will can have certain effects that will affect it for the rest of its life. Therefore, lots of public hospitals and even private hospitals, they will ask you to go for these classes so that they can let you know in detail what could and could not happen. So when you know what can and cannot happen, then when, if God forbid it happens during your pregnancy, then you know what to expect. And the last thing is, you must know your hospital. If you're going to deliver in a particular place, you must know where it is. Especially if you live in the Klang Valley. If you're living in say Gombak, and you want to try to go to Ampang Hospital at 5 o'clock in the evening, it will take you an hour and a half. So you must know how long it will take. You must know the best route to go in there. You must know where to go when you reach the hospital. You must know what to tell the doctor when you reach the hospital, and to know what will happen to you when you reach the hospital. Therefore, knowing your hospital, knowing what's going to happen to you, these are all important facets when you are pregnant, and these are things that you must know. And all of this you will know when you attend your antenatal classes. So those antenatal classes that we have, aside from telling you about pain relief, aside from telling you about the exercises that you can do and how your delivery process will be, we will also tell you where to go, who to see, and what to do during your labor, when you go into labor. Again, know your healthcare provider, distance, time, where to go. Make sure your healthcare provider knows you. Now, very often when you work in a public healthcare provision center, you find that you have never seen your patient before. And the patient sometimes has so many issues, but has chosen to come back home or come back to the kampong or to their mother's house for delivery. And suddenly you land up and you have a lot of problems, and the healthcare provider will not know how to manage. Therefore, if you have a pregnancy, it is good for you to know where you plan to deliver and to allow that doctor to see you, so that they know what to expect when you come in. They have got notes. They've taken note of what your problems are, or if you have no problems, how to manage your delivery, and they know what to do when you present when you are in labor. You must know the signs of labor. So lots of times you will start having pain, but that pain by itself, when you're say 7 or 8 months pregnant, is not labor. It's what sometimes we call false labor. So you must know what is labor, and most of the time, the signs of labor are when the pains become increasingly stronger, when they become quicker, and when you feel like there are other signs such as some blood coming out or water coming out. These are the signs of labor. So you must know that if you have this, you need to go to your healthcare provider. Even if you are wrong, it is better for you to go there and find out you are wrong than for you to sit at home and say that maybe let me see what happens. Quite often people get worried about eating before labor and delivery. It's okay for you to have a light meal before delivery. Unless, of course, you are one of those who has already been told that, look, you may not be able to deliver normally. You will need an operation to deliver your baby. in which case it might not be prudent for you to eat. Therefore, otherwise, for the average mother who is pregnant, it is good for you to have a light meal before your delivery. You must also know what kind of analgesia that you like during your labor. Now, pain during labor is not necessary. So even without the pain, you can deliver. Therefore, pain is not really necessary for you. Pain doesn't make your labor faster or slower. Okay, so you don't need the pain. So if you don't need the pain, it is okay for you to take some sort of medication so that you don't feel the pain. What's important are the contractions that you have. Lots of times when I was in a public hospital, I found that mothers have difficulty choosing what sort of pain relief they have. And during your antenatal classes, we will already tell you about the different choices that you have. So you should go home, think about it, and decide what sort of pain relief you would like, so that the minute you go in there and you are in established labor, you can tell the doctor what your choice of pain relief is. And sometimes everything that is being done and everything that is being monitored may not give us information on certain things that is going on within your womb. So if you think something is not right, you must inform your doctor that, look, I think something is not right. My baby is not moving like how he or she always moves. I'm having a little bit extra blood coming out from down below. I'm having this pain and it is not like the previous pain that I had. This pain is longer and it's making my tummy hard. So all these things are important things that you should tell the doctor, because the doctors and the healthcare providers may not be able to pick it up if you don't inform them. Now, after your delivery, again, it is okay for you to eat a little bit. Everybody will bleed after delivery. It is okay to bleed a little bit, but if you bleed excessively, or if you feel lightheaded, or if you feel dizzy, you must inform your doctor. If you feel there is a swelling down below, you must inform your doctor. And sometimes after delivery, because the birth canal is swollen because the baby has come out, you can feel some difficulty passing urine. Again, you must inform your doctor. And you will be given advice on your discharge when you are sent home from the hospital. During that time, they will tell you where to go, what to do, and if you have been on follow-up in a public hospital, that we will also make arrangements for the nurse from the clinic Kesihatan to come and visit you at home. Therefore, follow the advice that's given on your discharge. Quite often now, because like I told you earlier, in one of my earlier slides, where I alluded to the fact that blood clots are very important, becoming more prevalent in pregnant ladies, we find we will give medication for you to prevent blood clots from occurring in your body. Now, these medications must be taken and must be completed. These medications sometimes are in the form of injections. So lots of people, they do not want to take the injection, but it's very important that you take the injection, or whatever medicine that has been given for you. So you must complete it. If for some reason you feel unwell with the medication, you must go back to the place where you delivered and inform them. Even if you feel unwell for some other reason, if you have fever, for example, or if you have, and today we live in the midst of a pandemic, if you feel that you have other symptoms, go back to the place where your delivery was conducted. The reason you go back to the place where your delivery was conducted is because that's where the information is. That's where the doctors know what happened. That's where all deliveries are not the same. During delivery, sometimes certain actions might have been taken that another doctor in a different hospital might not know about So it is wise for you to go back to the place where your delivery was conducted, and if possible, see the doctor who conducted your delivery and let them know how you feel. We live in an Asian, environment, and we have we sometimes travel home to the kampong after delivery. If your place of where you wish to have your pantang or your postnatal stay is very far away, it is also not wise to travel long distances after delivery. So you should try to refrain from traveling long distances, especially in the immediate period after your delivery, and try to remain close to where the hospital where you deliver. You should also plan in advance. Plan to have somebody to help you at home. Your husband can help you, but if you need somebody else, maybe your mother or mother-in-law or a relative, to come and help you at home, because you will need help. You will be weak after your pregnancy, after your delivery. Therefore, it is good for you to have somebody at home. You must go for your postnatal visits. Postnatal visits are important because that's when we know whether everything has gone back to normal or not. During this, we will check you. We will look at your breasts, find out whether you're still breastfeeding, how your baby is. We will also screen you to see whether you have any lumps in your breasts. At the same time, lots of us do something called a pap smear to screen you for a cervical pathology during your after your delivery, during the postnatal visits. Now, when you leave the hospital, the doctors or the healthcare team would have spoken to you about contraception. Normally this is done after discussing with you when you would like your next child, and depending on how your age and how many children you have, and then you plan your contraception. Therefore, this is also done during the postnatal visits. So what I've tried to do here is try to just identify what really you wanted, what AMSA wanted me to speak about, and I divided it into four groups. What to do before you get pregnant, what to do during your pregnancy, what to do during your delivery and labor, and what to do after you deliver. So broadly, these are the four areas that are important. So so if you follow more or less what I've told you, I think things should be quite okay. I will now thank you, and I'm willing. I'll be happy to take questions if you have any.
Wow, thank you, Doctor. That is so informative. I am sure our audiences have learned a lot from you. At this juncture, we go ahead and take some time for question now. Just a reminder, if you have any question, please be sure to type it down into the comment section. Before we proceed to question in the comment section, I would like to bring up some questions that we have gathered from the registration form.
Okay, the first question that was here was, can I answer the question?
Yes, Doctor.
Okay, the first one was, what type of fluids do you drink? Actually, water is the best, preferably boiled water. So you drink a lot of water. So now, some people may want to drink. If you have no issues with your pregnancy is progressing well, some people would like to drink something like an isotonic drink, like 100 plus. That's okay as well. Milk is okay. Actually, any fluid is okay, but basically drink a lot of water. How much of water to drink? I'd say about 2 to 2.5 liters a day. Okay.
Thank you, Doctor.
Yes.
Next question is from Siva Muniz. Hi, Doctor. Does pregnant women in Malaysia largely being affected by diabetes during pregnancy? And how can we avoid it during pregnancy?
Okay. Now, on the average, the diabetic rate in Malaysia during pregnancy is about 10%. Therefore, if 100 people get pregnant, 10 people might have diabetes. Now, how do you avoid it during pregnancy? It's difficult. First, we go step by step. The first thing is, like I told you, before you get pregnant. If you are getting pregnant before and you know that you are at high risk of pregnancy, high risk of diabetes, so assuming you already have diabetes, or you have a very strong family history of diabetes, or you have certain risk factors in your in you that will probably result in you having diabetes, then before you get pregnant, you must identify all of this and try to remedy it. Now, if you present during pregnancy in the antenatal clinic with and you are already pregnant, then the doctors there will identify your risk. We have a risk scoring chart. So they will identify your risk. And if you are at high risk of getting diabetes, then we will start either we will check your blood and then tell you how to manage your diabetes. Now, if you are an average mother with no complications, everything is going on well, do you need to reduce sugar? The answer is really no. Do you have to take extra sugar? The answer is also no. Carry on with what you're doing right now, but just be careful about the amount of sugar that don't take in too much of sugar because you think that you're pregnant and therefore you need to increase your sugar intake. I hope, Ms. Siva, I've answered your question.
Okay. And the next question is from Ang Lin. Good day, doctor. Would you suggest companionship in labor during COVID-19?
Ang Lin, okay. Now, because your question, I'll break your question down into two. Would I suggest companionship in labor? The answer is yes, I would suggest companionship in labor during COVID-19. Now, if everybody who is there has been risk scored, you're very sure that your companion doesn't have COVID-19. We take efforts to make sure that the people who are working in the labor delivery suite are free from COVID-19, and we take universal precaution when we deliver. But if you are very sure that you have a companion during who does not have COVID-19, then it is okay for you to have in labor. Now, what do public hospitals today do? Because public hospitals, we cannot be very sure of the status of the companion. Most public hospitals today would prevent a companion, would not allow a companion to be there. That is merely an action that we take to ensure that the COVID does not spread. So to answer your question, companionship, yes. Companionship during COVID-19, yes, but unfortunately, it's not possible in public hospitals.
Thank you, doctor, for the explanation. And the next question is from Sri Raghavendra Maniarasu. Greetings, doctor. How will the mental state of the pregnant lady be, and how should it be taken care of?
The mental state, anybody's mental state, whether you're pregnant or not pregnant, is important. Everybody's mental state depends on whether you have an illness prior to your pregnancy, which requires medication. And anybody's mental state also depends on the amount of stress that you have, be it stress at work, stress at home, stress with other issues that are there. So if you have these stresses prior to your pregnancy, you must optimize it. Now, what sort of a mental state must you have when you are pregnant? You must be happy. The idea is to be happy. The idea is a happy mother will enjoy her pregnancy. So if you want to be pregnant, then it is important that you do everything to be happy, during and to enjoy that pregnancy. Mothers who enjoy their pregnancy go on to have babies who are also much better equipped to deal with life. So I hope, Shri, I've answered your question.
Thank you, doctor. Moving on to the next question from Shagan Ganen. Hello, doctor. During this COVID period, are the mothers allowed to see their child immediately after the delivery or need to wait for any screening beforehand? Thank you.
No, you're allowed to see your child immediately after delivery. So, that's quite straightforward.
And next question from AMSA UPM. Is there any effect of vitamin D deficiency on pregnancy outcome?
Yeah, there is. You see, where do you get vitamin D when we live in a tropical country. You get vitamin D when you're exposed to the sun. So very rarely we have patients who have vitamin D deficiency. But if you do have vitamin deficiency, then you are more likely to have diseases such as high blood pressure during pregnancy, or a condition called preeclampsia. You can get diabetes, you can have preterm delivery, and you can have small babies. So for the babies also, if the baby has vitamin D deficiency, then the babies can have allergies. They can have problems with their bones, brittle bones or soft bones, we call it. So those things can occur if you have this problem. But generally, we do not. We live in an environment where vitamin D deficiency is not a big problem.
And next question is, what are the supplements during the pregnancy that affect the baby cognitive function?
Okay, if you take a good, healthy, well-balanced diet, you don't need supplements. Okay, if you drink a lot of water, if you take a good, well-balanced diet with lots of fruits and vegetables, you walk every day, that's more than enough for the baby. So specific supplement, if you ask me, the only thing that I would advise is folic acid, because we know that folic acid helps you to get pregnant, one, and also helps you with reduces your baby's chances of having a problem with the spine or with the brain. So that's the only supplement I would advocate. Otherwise, healthy diet, lots of water, lots of fruits and vegetables, and walk.
And question from Jufri Mahade. Hello, doctor. Is postpartum depression common among new and young mother?
Postpartum depression can actually be divided into three. There is postpartum blues, there is postpartum depression, and there is postpartum psychosis. Postpartum blues sometimes is common. It's common because suddenly you have got a baby, you've got more responsibilities. One. Secondly, all these hormones in your body, which were there when you were pregnant, have reduced. Therefore, you will go through some amount of not everybody, but you will go through some amount of changes in your mood, which is called postpartum blues. It can come in after 1-2 days. It can be there for about a week or two, and then it goes off. Postpartum depression and postpartum psychosis are two things that are very not common at all. They occur, but they do not. It's not something that you need to be worried about unless you have had previous history of depression or blues. Otherwise, it is not a very common problem among new and young mothers. If you have good family support, if you have good support in your postnatal period, you have no previous history, you have taken a good diet, everything is okay, and you enjoyed your pregnancy, the chances that you will have any issue with your mental status after delivery is remote.
Thank you, doctor, for the clarification. Next question is, do you think preconception care is essential for a healthy mother and newborn?
Of course, preconception care is the most important thing. I must optimize you before you embark on a pregnancy.
Proceeding to the next question. Is there any association between incidence of eclampsia and the nutritional status and or the nutrient profile of a woman?
In the average population, no. You see, most of us here, we are quite okay with our nutritional status. We live in a country where we have ample food and nutrients. So for us, really, there's not much of an issue, you know. But in certain areas, if you're asking this as an academic question, then yes, you know. So if you live in an area where you have severe malnutrition, then yes. But aside from that, for us, the answer is no.
Next question is, what are the factors contributing postpartum mental health problems?
I told you before, that it's the same as before. One, if you have previously pre-existing health problems. Number two, pre-existing mental health problems. Number two, if you have a lot of stress. Number three, if you have not really enjoyed your pregnancy. Number four, some people say unplanned pregnancies and that sort of thing. But aside from that, these are the factors. So you should optimize yourself before you get pregnant so that you have taken care of all these issues. And if there's one thing if there's one message that I can pass to all of you, it would be you must learn to enjoy your pregnancy. And if you're going to enjoy your pregnancy, you must make sure that before you get pregnant, you optimize yourself so that everything is fine and you are ready to embark on the pregnancy. And during your pregnancy, you do not allow things to stress you or to upset you in any way.
Next question is, how to make sure newly couple marriage alert about the prenatal care?
By doing what AMSA is doing, have a lot more public forums, and I think nowadays with the on-site with the advances in digital technology and all of that, a lot of information is already there, about prenatal care and how to optimize. So aside from this, there is nothing else very much that you can do.
And next question is, are there any tips that pregnant mothers can do to ease them during delivery?
I repeat myself. One, eat good, have a good meal, eat good food, more fruits, more vegetables, drink a lot of water, reduce your stress, walk every day, and enjoy your pregnancy. If you enjoy your pregnancy, then the delivery will be much easier.
Thank you, Doctor, for the explanation. Moving on to the next question. Is that a myth or fact about the statement of pregnancy women cannot carry heavy objects and climb floors during pregnancy period?
Well, it is not good for you to carry heavy things when you're pregnant, because you should at the same time, it's not good for you to sit at home and not do anything. So you should do some amount of moderate work, but heavy things, no. Can you climb up one flight of stairs or two flights of stairs when you're pregnant? The answer is yes. Can you keep doing it over and over again? The answer is no. If you have a complication during your pregnancy that prevents you from doing heavy objects, like for example, if your placenta or the uri is low down, then of course you can't do all of this. So it is, I would say it is a myth, not heavy things. It's not a myth or a fact. You can do some amount of work, but it is not too much.
And next question is, can doctor please explain about ectopic pregnancy, its factors and risks?
Okay. Broadly, ectopic pregnancy means pregnant outside the womb. Now, the risks and the factors, there are many risks and factors. For example, if you've had a previous ectopic, that's a risk. If you've had previous infection down below, that's a risk. If you have had previous surgery down below, that's a risk. If you have had when I say down below, it means to your womb and to your tubes and to organs in the pelvis, down below, that's a risk. If you have had, if your womb is not the normal type of womb, meaning there's something wrong with your womb, then it's a risk. So, which is why the prenatal component of the talk is the most important. You must make sure that you see a doctor before you get pregnant, so that we can identify these risks and help you get pregnant and carry on with the pregnant properly. That is also the reason why I said you must go and book your pregnancy as soon as possible. Because if you have an ectopic pregnancy, it is good for us to know early. So, and one of the ways we find out whether you have an ectopic pregnancy or not before you become symptomatic is to do an ultrasound and see where the pregnancy is.
Next question is, why ideally does the mother need to consume the folic acid during 3 months before pregnancy?
One, because it will help you to get pregnant. And secondly, because it reduces the chances of you having a problem, the baby having a problem with the brain or with the spine. These are the two main reasons why we tell.
Thank you, doctor, for the explanation. Okay, thank you, doctor, for the explanation. Next question is, when women should start taking folic acid?
Ideally, women in their reproductive age group should be taking folic acid all the time. But if you're planning a pregnancy, it's good to start folic acid about 6 months before you get pregnant.
And next question is it okay if a pregnant mother wears tight outfits to hide their belly even though she's already 7 months pregnant? I saw this on TikTok once and I am scared of the baby's health.
Tight outfits will make you uncomfortable. They won't do anything to the baby. Sometimes tight outfits can go and compress certain nerves, and you can have some sensation loss in certain parts of your body. But it is not going to affect the baby's health. So, would I advise somebody to wear tight outfits? The answer is no. I'd like you to be comfortable. So wear loose outfits when you're pregnant. Are you worried about tight outfits affecting your baby? Then you shouldn't worry. It won't affect. But my advice is wear loose outfits.
Next question is, I have a question, but I think out of topic. Is it possible to be barren if we keep feeling hurt at the area below the belly button?
This is a very broad question. I think if you keep having pain below your belly button, the first thing you should do is go and see a doctor and find out why you are having this pain. The pain can be due to a lot of things. So if the pain can also cause you to have difficulty in conceiving. But to answer this question, if you have pain, first go and see a doctor and find out why you are having the pain.
And we have a question from Ng Chi Han. Good afternoon. Should doctor induce labor if the pregnant woman got uncontrolled hypertension? And which uterine stimulant is commonly used?
The answer to the first question is yes. If you have uncontrolled hypertension, you need to deliver. Uterine stimulant, it depends on which doctor you're seeing or which center you're going to. Most hospitals have got different protocols. Depending on the protocol of the hospital that you are planning to deliver in, they will decide on which one to use.
I have a question from Fire Glory. Hi doctor, can you share your experience of dealing with patients with poor prenatal and postnatal care? And in your opinion, how can we help underprivileged people regarding this?
Now, one of the things that we find is with regards to how can you help people. Now, the first thing that you can do is try to make sure that they have access to healthcare. Meaning that if you want to help somebody who's underprivileged, try to arrange for them to go for healthcare, to a hospital. This might mean taking them in your car to a healthcare provision center. This might mean giving them money or whatever to go to a healthcare provision center. The second thing is build up their nutrition. If they have got problems with nutrition, you want to help them, give them food, give them nutrients. Most of the time, I would just advise normal food with more fruits and vegetables. The third thing you can do is help them try to reduce the stress. If they are stressed because they need certain things to be done, then try to reduce their stress. The fourth thing that you can do is try to arrange for them to have good antenatal care, meaning that when they need to go somewhere, it doesn't mean expensive antenatal care. It means good antenatal care. And I would like to point out that the public health service in Malaysia is one of the best that you'll find in the world. Therefore, arrange for them to go there and get appropriate antenatal care during their pregnancy. And the fifth thing is, after you deliver, if you are underprivileged, would you like to help them to plan their next pregnancy, so that they don't suddenly land up with 3-4 children and close to one another, and they've got to take care of all of them, and they don't have the resources to take care of all of this. So one, prenatal, help them during the pregnancy, help them with nutrition and reducing stress, and postnatal advice on planning pregnancies.
And next question is from Rizky Rizwan. Hi doctor, is it possible for someone to show allergic symptom to folic acid?
Generally no, because folic acid is in your body anyway.
Moving on to the next question from Krisha Patel. Good afternoon, doctor. Is the COVID-19 vaccination safe for pregnant mothers? Will there be any side effect that could affect the fetal development?
So far, from the information that we have, the COVID-19 vaccine is safe. Now, is it 100% safe? Nobody knows. But it is safer than you getting COVID-19. So what is my advice? My advice is, if you are pregnant, get the vaccine. Okay? Most drugs, early pregnancy is the time where things are forming. So for the first 20 weeks of pregnancy, that's when all the vital organs are being developed. Therefore, most drugs, if they're going to, or vaccines or whatever, if they're going to affect you, they will affect you more at this time. If you're really worried, you can take it after this time. But in this environment today with this pandemic, take the vaccine. Am I 100% sure that it is safe? No, I'm not. Is there anybody who's 100% sure that it is safe? No, I don't think there is. Okay?
Thank you, doctor. Next question is from Fire Glory. Doctor, can a mother who is infected with COVID-19 breastfeed her child?
Yes. No, that's answer. It's a straight answer.
Just a reminder again to the audiences, if you have any other question, please type it down into the comment section. I think that is all for the question for this workshop, just like the time has permitted. Again, thanks to Dr. Murali Ganesalingam for sharing such a detailed and clear explanation to us. This concludes our Q&A session. Moving on to our next agenda, presentation of e-certification. As a token of appreciation, we are really honored to present a certificate of appreciation to Dr. Murali Ganesalingam for his time and valuable talk about prenatal and postnatal care.
Thank you for inviting me, and thank you for the good work that you all are doing. Okay, I hope you continue with this.
Next, let's wrap up our workshop with some photography session with the speaker and the board of directors of this event. Three, two, one, smile. Thank you, Doctor.
Okay, bye. Thank you for inviting me, and all the best.
Thank you, Doctor, for your time. At this moment, in conjunction to Mother's Day, I would like to invite Bradley Tan to deliver a song that is specially dedicated to all the mothers out there. Let's all enjoy the performance.
So thank you, and I would like to wish all mothers out there a very happy Mother's Day.
That was indeed a meaningful and splendid performance by Bradley. Before ending our session, I would like to take this opportunity to wish Happy Mother's Day on behalf of AMCCS UPM. One day a year isn't enough to celebrate motherhood and everything our moms do for us. Again, to all the moms out there, Happy Mother's Day. That's it for this prenatal and postnatal care workshop session. We really appreciate your involvement. We would also like to thank everyone who made this session possible. Attention to participants who have registered for the next session. You are kindly told to follow the highlighted YouTube link for the next session of this program, which is Child First Aid. Attention to all participants. Now a QR code for the merits of the participant will be projected on the screen for 5 minutes. The post-registration link will also be provided in the comment section. The post-registration link will be accepting response for 10 minutes only. Participants can still access the link after the end of the session. Thank you. Goodbye and have a nice day.